Well, our bodies don't always age gracefully. We undergo lots of changes as we get older.
Don't I know it? And that includes our eyesight. But Charlotte Eye, Ear, Nose, and Throat Associates can help keep your eyes healthy and your vision strong. Colleen shows us how.
We're here at Charlotte Eye, Ear, Nose, and Throat Associates with Dr. Barbara Lee to talk about how aging affects the eye. And one of the most common things you see, this is affecting me for sure, when we hold the paper out like this, when our eyes don't quite work as well as they used to. What is that called?
So that's called presbyopia, and that's one of the most common things that we see as people get older. It hits everybody at some point, usually about age 40. It just signals the need for reading glasses.
And it's totally normal as we age.
Totally normal, and unfortunately, nobody enjoys it, but it's a fact of life.
Reading glasses for sure. Okay, the next thing that can happen to the eyes as we age, glaucoma. Tell us what that is and why that's a problem and how you fix it.
That is one of the diseases that we can see, particularly over age 40, although can occur at younger ages as well. It is associated usually with high pressure in the eye. That's what most people think of when they think of glaucoma. And but ultimately, it affects the optic nerve, which is the main nerve that connects your eyeball back to the brain. The pressure kind of hits the nerve, causes damage there, and you do ultimately lose peripheral vision, typically with glaucoma, but can be treated usually very well with eye drops. Sometimes requires other treatments, including laser or surgery.
Dr. Lee, you've got this here to show us an example of cataracts, another common problem as we age.
Correct. Cataracts affect almost everybody because it really is just an aging change of the lens in the eye. The lens sits here, which is right behind the iris or the pupil in the eye. It's a clouding of the lens. It occurs as new cell layers are constantly put down in the lens as we age, but we never get rid of any of the old ones, so it kind of all gets trash compacted down on top of itself.
So what do we do about that?
So that's easily taken care of with cataract surgery, which is just a very routine surgery, usually about a 15-minute procedure. Taking out the cloudy lens, we replace it with an artificial lens implant that allows people to see so much better, and often can help to reduce their dependence on glasses as well.
That's a good thing,
which is
for
nice.
Sure. What about macular degeneration? Again, another common problem as we age.
Correct, and that is the most common disease affecting central vision in this country, affecting about 10 million folks in this country. It is a disease of the retina, which is this red kind of wallpaper in the back of the eye, if you will. The retina is the sensory layer of the eye that picks up light signals and sends them to the brain. With macular degeneration, you see deposits forming within the central portion of the retina, termed the macula, and that can affect your ability to see centrally. Most people may start with maybe some wavy vision in the middle of their vision. Sometimes some black spots appear that you can't see around. That can cause some real significant changes in the vision.
So again, if you're experiencing any of those symptoms, you should come in and see a doctor.
Absolutely. Absolutely. The key with most eye diseases, because a lot of them can occur silently without causing real blatant symptoms to a patient, is getting a routine eye exam.
And the bottom line, too, to keep our eyes healthy, really keeping up with those doctor's appointments and coming in at least once a year to get our eyes checked.
Absolutely. Absolutely. That is the key.
Okay, well, you can come here to see Dr. Barbara Lee or anyone on the team here at Charlotte Eye, Ear, Nose, and Throat Associates. Thank you so much.
Thank you very much.
Okay, now you
I know, right?
or you can contact Charlotte Eye, Ear, Nose, and Throat Associates at 704-295-3000. That's 295-3000. Or visit goodsenses.com. That's goodsenses.com in case you need help. I'm not saying that you do.
I think I need help. All right, well, come